Hello, everyone. How is everybody doing? I am Dr. Anshul Gupta, and welcome everybody to our live session. So, we are starting these Thyroid Thursdays, where I would like to kind of share and talk to you all about different aspects about thyroid health and what you can do to improve it. So, we are going to touch base, on whatever questions you have related to thyroid or any other healthy things or anything you want to know more about it. So you can obviously post those questions in the comment section so I can try to cover as many as possible. So we'll wait for those questions to come up. But meanwhile, I will introduce myself if people who don't know much about me. So I'm Dr. Anshul Gupta. I am a board certified family physician trained in United States. And then I also did one certification in functional medicine and integrative medicine. And I now help people worldwide to reverse their thyroid conditions by making personalized functional medicine plans. So my goal is to educate people, who have any kind of chronic health conditions like thyroid, Hashimoto's, or hyperthyroidism, Graves' disease, or symptoms of thyroid problems, and what they can do to get better. So, everything that I do now, my mission is to help people improve their health through natural ways, mainly through supplements, lifestyle changes, different kinds of diets, all that stuff. So, first of all, I want to thank you all for being present over here from different parts of the world. And I want to show your gratitude, all the love that you have given to our channel, my Anshul Gupta MD channel, which has grown so big. And I keep on reading all of your comments and the love that you share with us. So I really, really want to thank you from the bottom of my heart that you guys are there and supporting us. So thank you. Yes, keep supporting us. Keep sharing this knowledge with anybody who can be benefited from this information. Very important to know over here is that we are not sharing any medical information. So before you make any changes in your regimen or your plan, please make sure you're talking to your doctor about it because we don't know your complete medical history and don't want to harm your body. It's only education that we are sharing over here. So you are educated and informed about what choices you have. Great. So let's see what questions we have over here. So somebody has this question about whether flax seeds or fenugreek seeds or coriander seeds, are they okay with hyperthyroidism or not? So again, hyperthyroidism is mainly happens because of Graves' disease, right? And Graves' disease is an autoimmune condition where your body is producing antibodies, which is causing your thyroid to produce excessive thyroid hormone. So we are trying to do each and everything through diet and other things, which help to reduce the inflammation and autoimmunity. Now, these fenugreek seeds, flax seeds, they have shown improvement in Graves and hyperthyroidism situation because they help insulin resistance. Plus, flax seeds have high omega 3 levels, especially if you're a vegan or vegetarian. So, that can be very, very helpful. Coriander seeds actually can be helpful for detoxification for the body as well as good for digestion. So that's where, and the other seeds, fenugreek seeds, improves your insulin sensitivity, and insulin spikes are a very major cause of inflammation in the body. So most people, if they do have Graves' disease, or hyperthyroidism because of autoimmune conditions, then I think these food should be helpful for them. Honeycomb shares over here, her daughter, 13-year-old, has Hashimoto's, and she was started on thyroid medicine, and her anti-TPO antibodies are high at 300. Yes, those are high antibodies, and we are seeing more and more young females are being diagnosed with Hashimoto's. And this is a big change that we have seen in the last decade. Previously, only middle-aged females were being diagnosed with Hashimoto's. But now I am seeing so many young females being diagnosed with Hashimoto's and coming to our practice. So yes, a lot of things can be done. I think lifestyle changes are a cornerstone of Hashimoto's disease. I've made several videos, if you're following us on the channel, where I've made videos about reducing the TPO antibodies, about what is the best diet for Hashimoto's. So please, you can look into those videos and see what applies to your daughter. and obviously work with your physician of supporting your thyroid. Um, Lavanya has this question whether millets are good for thyroid or not. And that's a very important topic, actually, I want to touch base on. So, millets are gluten free grains. Well, at least majority of the millets are. And a lot of people, like have this notion, or people have been sharing this information that millets might not be the best for the thyroid. Now, we don't have any research studies which shows that millets as a whole are bad for thyroid. Now, if people know, there is something called AIP diet. In this autoimmune protocol, people actually remove grains completely. And we have seen that some of the AIP diets can be helpful for autoimmune conditions. So, similar way, some people might be sensitive to millets, and for them, like they can actually be the reason of their thyroid antibodies. But for 90% of people, millets are fine to consume, and there's no research study which suggests that millet are actually anti-thyroid or goitrogenous or actually harmful for thyroid. So we don't see that happening. So for majority of my clients or patients, I think taking millets is fine. And the good way to monitor things is that maybe give up gluten and millets completely for 4 to 6 weeks. Check your antibody levels and see if you see a significant improvement, then yes, your body is telling you that millets are not for you. But if not, then I think consuming millets should be fine. I don't see like a major problems with eating millets because they're gluten-free grains. They are dense in a lot of different nutrients. Plus, most of the millets, are also dense carbohydrates. That means that they do not spike up your sugar that much. So I think millets overall are good things. Um, Then people have this question about pregnancy, how to manage thyroid during pregnancy. Now, that's the most difficult question to answer because pregnancy has a lot of complications, and we do not want to do things in the pregnancy that can harm you or your baby. So it is very important to work with your OB/GYN during the pregnancy for thyroid or Hashimoto's disease. Yes, maybe you can make a few changes from the lifestyle aspect, mainly working on your stress and mainly working on your diet. Eat a healthy diet, very important. I think those are the main things you can do during the pregnancy. And most of the females are taking certain vitamins and minerals during pregnancy, anyways. Like their prenatal vitamins, like omega 3s, all those things, and making sure that you do have good iodine source also. Because during pregnancy, we need good amount of iodine to support not only the pregnant female, but also the child that you are carrying. So make sure that the prenatal you're taking has iodine into it, or if that is not having iodine, then again making looking at foods which are high in iodine like iodized salt or sea vegetables. Again, like there are at least 10 plus foods which are high in iodine. And again, like if you're following my channel, then we have already made several videos on foods which are high in iodine and things. But beyond that, working with your OB/GYN and following what they want you to do is very important, especially during the pregnancy time. That's great. Wow, we have a lot of questions coming up over here. We might not be get go over all those questions, guys. So I apologize, but we will be doing these thyroid Thursdays from now on, every Thursday. So if I don't go over all your questions, it's nothing personal against you. We will try to get to as many as we can, and we will try to answer. If there and not answered any questions, then we'll try to do it next time also. But let's go over a few more. Um Question about how to reduce the thyroid swelling in thyroiditis. So again, thyroiditis are for various reasons. It can be Hashimoto's thyroiditis, which is autoimmune in nature. Then there is obviously viral thyroiditis, where you have a viral infection. They can also be thyroiditis just because of inflammation in the body, or there can be also thyroiditis which is happening because of allergies. So depending on what thyroiditis that you have, then you obviously have to take relevant steps for it. If it is an acute situation, again, making sure you're seeing a local doctor. They're doing all the blood work and all the testing to make sure that your thyroid levels are not in the dangerous side. That is the first thing that you should be doing. And if it is a chronic thyroiditis or a chronic swelling situation, then again, you need to work on that inflammation and autoimmune aspect of things. This is where, again, doing a good diet is useful. A lot of times, certain supplements like zinc, selenium, vitamin D, omega 3s are also good. that can help support your thyroid gland and also reduce inflammation into it. And selenium has good research studies along with iodine that can help, with thyroid swelling. So that is again good things that certainly that people can do and take also. Okay, people have questions how to consult you. So yes, the best way is that emailing us to know more about our programs and things. The good part is that we try to accommodate as many patients or client as we can, but we are getting a lot of requests these days. Since like a lot of people have showed a lot of love to us on YouTube. So apologize if we were not able to get to everyone, but you can always email us. Go to our website. There is a contact us form over there. Our website is anshulguptamd.com, and fill up the contact form and we'll try to get in touch with you as soon as there is an opening and working with us, and we'll go from there. Okay, so let's see. So somebody has this question: subacute thyroiditis, TPO antibodies are below the level, but the FNAC test showed that Hashimoto's. Can it be Hashimoto's? Yeah, very interesting question. Antibody negative Hashimoto's, is that a reality? Yes, it is a reality. So, just 5 or 6 years, like in American Thyroidology Association had a meeting, and there were a lot of physicians who were sharing these cases where their patients were presenting with thyroid symptoms of Hashimoto's symptoms, but their antibodies were negative, and their antibody was not showing up. But trying to do like putting on medicines or doing other things actually helped them out. So then now we realize there is also entity which is called like antibody negative Hashimoto's disease, where your antibodies might be negative, but you might have signs and symptoms of Hashimoto's, and plus you might have other things like some of your thyroid numbers might be off, or like as you did an FNAC, which is an FNAC is basically a biopsy of your thyroid gland, where they're using a needle to take a very small kind of tissue out of your thyroid gland and looking at it under the microscope. So if the FNAC is showing signs and symptoms of Hashimoto's, you might be in a very early stages of Hashimoto's, and sometimes the antibodies do not catch up during that time. So definitely, if you do have signs and symptoms of Hashimoto's, which I think most people already know about it, but I'm going to repeat, Hashimoto's symptoms, which are that if you feel tired or fatigued, if you have brain fog, if you are not able to lose weight or you are not able to gain weight, both of them are Hashimoto's symptoms. If you feel cold all the time, if you have gut related symptoms like constipation, diarrhea, bloating, um, if you have menstrual issues, if you have mood changes, feeling depressed, feeling anxious at times, all of those are symptoms of Hashimoto's disease. So if you have any of those things, plus like your FNAC shows that you might have Hashimoto's disease, then I think you should start working on natural ways like diet, lifestyle changes, stress management to improve your thyroid. So great, yes. So antibody negative Hashimoto's, guys, that's probably the first time that you might have heard it over here. So yeah, it is a reality that there is Hashimoto's disease, which is antibody negative, presenting with all the symptoms. So that's the interesting piece about thyroid. We know so little about thyroid and Hashimoto's disease. Most people that I see in my practice don't even know what Hashimoto's disease is. They have just been told that they have hypothyroidism or low thyroid, and they have never been checked for Hashimoto's. So that's the first thing that I recommend each and every person who have been diagnosed or told that they have a thyroid disorder like low thyroid or hypothyroid, ask your doctors to check you for Hashimoto's disease. The reason being, Hashimoto's is an autoimmune condition. What that means is that your body is making antibodies to destroy your thyroid gland. And the medicine, the levothyroxine, is not doing anything to safeguard your thyroid gland. It is not doing to reduce inflammation. It is not doing anything to take care of the autoimmune process. That's where functional medicine comes into place. Again, I'm not saying that you should be stopping medicines or like you should give up your medicines. I'm just saying that there is something beyond the medicines that you need to do to help improve your thyroid. So that's great. The next question is that if you have amalgam fillings, can you improve Hashimoto's or reverse it? So basically what this person is asking is about concern about mercury toxicity. So a lot of times we have these dental fillings, and if you open up your mouth and if you see some silver fillings in your teeth, that's those amalgam fillings. Unfortunately, those silver fillings have mercury in them, and over the course of time, like months to years, these mercury fillings, start breaking down, and they release that mercury toxins in your body. There are several research studies which shows that mercury can hijack your autoimmune process as well as your thyroid, doesn't let your thyroid hormone to function, as well as it causes thyroid antibodies to go high. That's the reason, like people want to remove mercury from their system. So the question is that, if you have mercury fillings, can you improve Hashimoto's? Yes, you can improve Hashimoto's disease, because mercury is only one aspect of Hashimoto's. If you work on all of the other aspects like leaky gut, like working on inflammation, like supporting your detox system, so whatever mercury is being released from these amalgams, your body is able to process, then definitely you can improve your Hashimoto's. Now, can you reverse it completely with amalgam fillings? That's the question, depending on how high your mercury levels are. So maybe you can check your mercury levels and see what's happening with those. That's the first step. There are different ways of checking mercury levels in the body. That's again an important question. A lot of people don't know about how to get my mercury levels checked. So to check your mercury levels, like different ways. One is obviously checking your blood levels of mercury are not stable, and they do not tell the total body burden of mercury in your system. So it is better to check a hair analysis or a urine analysis for your mercury toxicity. That's the only way you can know your mercury levels. All right, great. So that I hope that answers your questions. Let's keep moving forward. Is Hashimoto's genetic? I mean, if someone is having Hashimoto's, would it impact his sons or daughters? So we always play this genetic card a lot. Anybody who has diabetes, oh, it runs in my family. Anybody who has Hashimoto's, it runs in my family. Genes only mean that they increase your chances of getting a particular disease. But that increase in chances is not a definite chance that a person or your children are going to get it. Most of these autoimmune conditions like Hashimoto's disease are environment related or lifestyle related, because our genes suddenly did not think that we have Hashimoto's, right? Because if you talk to your maybe your grandparents or so, they did not had so many thyroid problems or Hashimoto's disease. Why suddenly we all are developing thyroid problems? So it is not because of genes, because our genes are not changed. It is because of the environment that we are putting these genes that's changing. And that's the reason we are getting more and more people getting diagnosed with Hashimoto's disease. So, by improving your lifestyle, by doing the right things, you're not only improving your health or lifestyle, you're also setting an example for your kids. And if your kids do the right things, then they should not be getting Hashimoto's disease. So, genetic doesn't mean that's a death sentence that they are going to get Hashimoto's. It just says that yes, they have to be extra careful. Okay, a lot of questions are pouring up over here again, guys. I totally apologize. So many things are there. Um, and again, you can always submit these questions later on for us too. Um, I have anti-TPO antibodies up to 1300. Wow, that's very high of antibodies. But I'm not on thyroxine. Should I be taking it? So again, as I explained to you or anybody, right? So the levothyroxine is basically not doing anything, right? It is not doing anything to improving your autoimmune process or your antibodies. The levothyroxine is only doing things actually to improve your thyroid hormone levels. So if your TSH, if your thyroid hormones levels are normal, then your levothyroxine is not going to do anything to lower those antibodies. And the way I actually, like it's also important to know, a lot of people don't know this also determination between how high their antibodies are and how serious their Hashimoto's disease is. So the way, again, obviously there is no research behind it, but, based on my experience, what I've seen is that if those TP antibodies are less than 100, then that's a mild Hashimoto's. If those antibodies are between 100 and 500, then that is a moderate Hashimoto's disease. And when those antibodies goes beyond 500, then that is a severe Hashimoto's. That means the destruction of your thyroid after your antibody levels have reached more than 500 is happen at a very, very fast rate and at an exponential rate. So those are the people, who will go on thyroid medicine sooner or later, or their thyroid medicine dosage is going to keep going up and up, because each and every day their thyroid is being destroyed at a very fast rate with all of these antibodies. So that's a huge, huge destruction that happens because of these antibodies. So again, much more important reason to follow all those things, that we discuss, in previous, like, lives, or like, in previous kind of videos of what you can do to lower the antibodies. If you have not checked out, again, please, like, I made a special video about how to lower TPO antibodies, so check our channel. So that will give you a lot of tips and tricks into lowering the TPO antibodies. Okay. So somebody has this question about what are symptoms of Hashimoto. So we already discussed those things for you. um, if we have hypothyroidism, is it okay to get pregnant? Absolutely, yeah. I mean, hypothyroidism doesn't mean that you cannot get pregnant. What it means is that it is very important to work with a good OBGYN, like your OB doctor, who knows about Hashimoto's and hypothyroidism, and putting in the right dosage of the medicine. Because what happens is that in pregnancy, because of the demand of the pregnancy, our thyroid hormone levels naturally goes down. So your medicine dosage might needs to be adjusted during the pregnancy, especially in the first and the second half of the pregnancy. So very important to work with your OB on a very close basis during the pregnancy for your hypothyroidism, so you can get on the right medicines and they can make adjustments quickly for you. Okay. Somebody asked me this question. Jenna is asking this question whether I have some detox sprays, or zeolite sprays, or detoxifying heavy metals. So, no, I have not made any detox supplements for our line. We do have a supplement line which have, like, some general supplements of supporting the thyroid. A very great thyroid supplement actually we have made, which has all the good things, to support your Hashimoto's and hypothyroidism, like zinc, selenium, L-tyrosine, ginseng, some adaptogens, some other vitamins. Because, like, a lot of the other supplements, have all these things separately, and we have combined all of those things together with good qualities. So you can always go on our website called anshulguptamd.com, and there is a shop button out there where you can check these supplements. So, but we have never made a detox supplement, because what I've realized is that detox is a pretty intense procedure and it can go very quickly in the wrong direction. I've seen so many people trying to detoxify on their own. Interestingly, I just want to kind of share this, that, just a few days ago, like, we were actually just a client came to see me because she was kind of, bought a detox kit online, and she started doing it because, again, she heard somewhere that, Hashimoto's can be because of toxins. And actually, after she started the kit, within a few weeks, she actually got worse. Her symptoms got worse. She was brain foggy. She was feeling tired and fatigued. And when she came to see me, we told her that that was because of all that wrong detox she was doing, because that was not appropriate for her body. So I don't recommend doing people any detox supplements on their own. I think it's best to work with a professional, like a functional medicine or integrative medicine professional, for a detoxification. You can use diet as detoxification. In that aspects, all these green leafy vegetables, cruciferous vegetables, are good for detoxification. They have sulforaphanes, which aids detoxification. Plus, things like turmeric, like ginger, good for detoxification. Deep colored vegetables like beets are good for detoxification. Green tea is good for detoxification. So these are all food, that can help you with detoxification. So you can definitely use these. I think that's what I tell people. I generally don't recommend doing a detox on your own. Okay. So then the other question that, over here is that, my mom has TSH and low thyroid. How often can we test while on home remedies? So testing, I think 3 to 4 months is a good amount of time for testing. Anytime, whether you are on thyroid medicines, but if you're making changes, then you can do testing every 3 to 4 weeks also. Because whenever you do a change into your program or anything different you're doing, then basically what you can do is that you can check your thyroid hormone. Takes 3 to 4 weeks to stabilize from any new change you're doing. So I think, like, the minimum is 3 to 4 weeks, but I think, doing it every 3 to 4 months would also be fine. um Okay, so then we have this question. A lot of people have this question about dairy and curd and yogurts. So whether yogurt is good, whether if they have hypothyroidism or Hashimoto's, or kind of hypothyroidism, is yogurt or dairy good? Because obviously they are fermented foods, and they have been told that fermented foods are good. So what research have shown is that a lot of people, who do have Hashimoto's or hyperthyroid condition, those are the people who are much more sensitive to dairy as compared to any other person. So I do recommend people leaving alone the dairy for at least 4 to 6 weeks and observing their body and see how they do. If giving up dairy, which includes a yogurt, unfortunately also, or curd, then if you see an improvement in your numbers or see an improvement in your symptoms, then your body is telling you that maybe the yogurt and dairy or curd is not good for you, and it is better to stay away from it. Yes, the yogurt do have probiotics, but there are other foods which are high in probiotics. Obviously there are kimchi, sauerkraut. Then, if you're an Indian person, then, all those fermented foods like idlis, dosa, South Indian foods are good. Then some kind of pickles can be made, not the traditional pickle which has a lot of spices into it, but some pickles, can be made, which are fermented. Again, a lot of different recipes are there that will also help you with those things. And then obviously you can take a probiotic also if you're concerned about just, like getting good bacteria in your gut. Then probiotics are a good source. Awesome, great. I think we are running out of our time. So Sania is saying I skipped your question. Sania, I'm really apologize. Let's see. Okay, Sania says my thyroid is normal, but I have Hashimoto's, and I feel like something stuck in my throat when I swallow my saliva. What to do? So again, that's a very common issue that we see, that people, who have Hashimoto's disease, that, they feel something is stuck in their throat. So that can be because of thyroid enlargement, because thyroid is right there in your throat. It might not be shown outside, but it might grow inside, and that might be causing some pressure on your food pipe. That can obviously the reason. Lot of inflammation from Hashimoto's thyroid gland can again go towards backward and cause this thyroid, or sorry, swallowing difficulty. So that could be the case. So first of all, making sure you're going to your doctor and doing an ultrasound of your thyroid to see if it is enlarged or if it is inflamed or not. I think that will be the first question that you need to answer and see, because if something is really, pushing your food pipe, then you should be knowing about it. So I think following with the doctor and talking him or her about it would be the best option for you. Okay. So I think a very important question a lot of people have is about hair loss, right? So Johnny over here talks about, okay, well, he's a young male and he's losing his hair, and what he can do about it. So hair loss is the most difficult symptom of Hashimoto's or thyroid disorder to improve, because obviously, like, hair cycles take a long time to grow. And in Hashimoto's or thyroid disorder, all of these antibodies, all this inflammation is destroying your hair follicles, not the hair but hair follicles. So we have to regenerate these hair follicles, and plus, you have to work and wait so that your body starts producing more hair and hair follicles. So first of all, reducing inflammation is very important in that aspect. Selenium and zinc are very good minerals which support your hairs as well as reducing inflammation. Fish oil or good omega 3s are also good in that way, which can help support your hair growth and hair health. So that will also be very important for you. You can do that. And obviously collagen has shown that it can also improve the hair health. So collagen protein is something that, can be taken. Otherwise, I've made another video which I share in a lot more details about various things that can do for hair loss. Again, you can check that video on our channel, especially which has been made for people with hair loss. I share a lot of different remedies and things, that might be helpful over there. All right, guys, I think we had this short amount of time this time. I am really overwhelmed and glad that we have so many questions over here. And as I said, apologize that we are not able to get to it. We are running out of time at this point of time. But as I said, we are going to do these Thyroid Thursdays on the regular basis. Please, and share your comments, and again, any topics that you want to cover, please do that. And what we'll try to do is that actually we'll try to create a post. So keep following a channel and the community post, where actually we will ask you to post your questions beforehand, because we never knew we are going to get so many questions. So I can see that I am not able to get to all of the questions, which we definitely will try to. But we'll create that post, and you can post your questions beforehand, and we'll make sure that I'm answering those questions first. People who are submitting their questions for the next live session, and I'm going to make sure that we answer those for you. And then but we'll keep meeting every Thursday. We'll try to meet, greet, and share information, and answer your questions as much as we can. So, as I said, apologize that I'm not able to get to all of the questions. We are running out of time today. But thank you so much for showing the love and coming over here, spending some time with me and on my channel. Um, as I said, we are going to create a post about what questions you further have, which I'm not able to get today. So please, share your questions over there. These live sessions would also be available later on. So even if you're not able to attend the live session, you can post the question and you can watch them later on. All right. Thank you so much, guys. It was really, really a pleasure, and an honor to share all this information with you. And we will see you same time, same place next Thursday, guys. All right. Take care now. Everybody, take care. Bye bye.